Did you know that proper hygiene can help to speed up the wound healing process? Infections can drastically slow down wound healing. And the reality is, wounds are more vulnerable to infection if you do not clean them properly. Try your best to avoid touching the wound. However, if you have to touch it, make sure your hands are washed with antibacterial soap before dealing with the wound. I recommend you use gloves whenever you're dealing with a wound in any form or fashion, whether it's changing a dressing or retaping a dressing or anything like that. Let's talk about showers. Can you take a shower with your wound? And the answer is, it depends. This is where your wound care specialist comes into play, and they can help to guide you on whether you're a candidate for taking a shower with your wound or not. Sometimes we say you can get in the shower. That you can't get in the shower. Sometimes we say you can't get in the shower. That doesn't mean you can't take a sponge bath, which will help to decrease the bacteria bioburden on your skin. Sometimes we will recommend that you put a bag over the wound or the dressing and seal it with tape. However, keep in mind, if the dressing does happen to get wet, you can't just leave it on. You have to change it. This is terrible because that dressing is now full of soap scum and all the bacteria from everywhere else on your body, and it's just sitting there on your dressing, on your wound, and your dressing is just holding it in. Believe it or not, there are parts of the country where doctors recommend that patients do get in the shower with a water pick. And you turn on the water pick and you beat the wound with that water pick. What this does, it helps to decrease the bacterial bioburden. Yes, this is still being practiced today by many. What that does do, it does help to decrease the bacterial bioburden. However, the doctor generally has a trust in their patient when they recommend that, meaning they know that when they're finished with their shower, they're going to put on gloves, keep it clean, redress the wound, replace the dressing, and make sure they decrease contamination. If you have pets, please keep your pets away from the wound. I cannot tell you the amount of times I've had a patient say something like, yeah, my dog was licking the wound, or my cat was rubbing up against the wound. This is a no-no. This is improper hygiene and leads to infection. We don't want this, guys. Of course, need I need to say, no baths, no time in the pool. This is not the time to go to the beach. Be safe.